Hey everyone, Dr. Sabouni. I'm excited to be talking to y'all tonight a little bit about egg freezing. This is a topic that's near and dear to my heart. I'm going to go through a little bit of the overview, but the most fun part of this evening is going to be the questions that you submit. So don't forget to submit some fun questions for me in either the Q&A or the chat function. So let's get rocking and rolling with a little talk about easy breezy egg freezing. All right. So first of all, let's start off with what is egg freezing? So if we think about it, egg freezing is really preserving your reproductive potential in women of reproductive age. So this goes by a lot of different names because we as women were born with a set number of eggs and we kind of we lose them over time. And so we call this planned oocyte cryopreservation. So that's the current medical term for it. But it's also social and elective egg freezing, egg banking, and even a concept of egg insurance. So when you think about the history of egg freezing, well, it can't be shared without knowing a little bit about IVF. So the first IVF baby in the world was born in 1978, and that was followed by the first IVF baby born in America, which is 1981, Elizabeth Carr at the Jones Institute. And then it wasn't until 1986, so about 5 years later, in which the first human birth was recorded in the medical literature that resulted from utilizing a frozen egg. So it wasn't until from 1986 to 2013 where the American Society of Reproductive Medicine repealed their experimental label that was placed on elective egg freezing. So obviously egg freezing was done for fertility preservation for cancer patient, but this elective egg freezing, it was repealed back in 2013. And basically in their statement, the American Society of Reproductive Medicine stated that the success of oocyte cryopreservation has improved dramatically over the past decade, and the preliminary data for safety are reassuring. Therefore, this technique should no longer be considered experimental, and hence egg freezing has kind of taken off from that point. So why is egg freezing important, and why is it something that you're hearing a lot about in the media currently? Well, as you know, and as I kind of stated earlier, so we as women, we are actually born with the maximum number of eggs that we'll ever have in our life, and we lose them over time. So when we're about 19 weeks to 20 weeks in utero, we actually have the maximum number of eggs, about 6 to 7 million. And then by the time we're born, we're down to 1 to 2 million. By the time we actually hit puberty, we're down to 300 to 500,000, out of which during our reproductive years, we'll maybe ovulate 400 to 500 of those eggs. That's it. Only 400 to 500 out of those millions, right? And by the time we get to menopause, we're down to about 1,000. So it's not that we have no eggs, but we're down to about 1,000 eggs. And so one of the reasons why this is super important is because I think that there's this false perception out in society today based on maybe some of the things that we're seeing on social media or by seeing in terms of the media in general, that we're seeing women at older ages being able to conceive. The problem is that, you know, I can tell you from an infertility standpoint that a woman at the age of 45, the likelihood of her conceiving with her own eggs is fairly uncommon. So, you know, it's very important to educate women that it's not only about the number of eggs that you have left, but also the quality of the eggs. So remember, we have ways of measuring the quantity of the remaining eggs that we have, but we don't actually have any type of test that can give us an idea of the quality of the eggs, like a blood test that I can run on you. The only surrogate I have is your age your age, right? So if you're a 30-year-old versus a 35-year-old versus a 40-year-old, the quality of the age are significantly different. And remember, as we get older, we have a higher likelihood of having children with chromosomal abnormalities like Down syndrome. So that's why this is something that's really important, because if you're not planning on having kids in the near future and you know that you're getting rudely up there in age, then maybe something to consider is freezing your eggs or reevaluating your plans. So what are the common reasons that women plan to freeze their eggs? Well, according to the study, the number one reason, about 88% of respondents said that they don't have a partner. And that's commonly what we see in practice as well. There's a lot of deferment because of professional, social, financial, or even health reasons. We know that as we, with diminishing ovarian reserve, that biologically our egg quality, remember that thing that we were talking about earlier, is better before the age of 30. There's also ethical, religious, or legal reasons to freeze eggs. For example, in some countries, they don't allow you to freeze embryos because of their definition of life. So you have to freeze eggs. And there's also this concept of a fertility insurance, right? We don't know what the future holds. And so it's important to, if you have a diminishing asset, to perhaps take some consideration in terms of preserving that asset while you still have the ability to. So who is a candidate for egg freezing? Well, the typical egg freezing candidate tends to be a proactive woman who cannot or does not want to start a family right away, but does want to preserve their ability to have children in the future. So it's not necessarily that they have to want to have a family in the future, but they want to be able to preserve their ability to. So usually these best candidates are usually women in their 20s or 30s who are delaying pregnancy by at least 2 years, 1 to 2 years, depending on your situation. If you're older, even 1 year of deferment might be a reason for you to freeze your eggs. So what does the process look like and what can you expect? So typically you come in for a consultation with us, and I promise we're very nice people. In that consultation, we'll talk about your medical history, and then we'll make a game plan to do some ultrasound and blood work so that we can get an idea of where you are, at least in terms of your egg quantity point of view. Then we'll sit back down together and talk about what your individual results showed. What does it mean? And get an idea in terms of what to expect during your actual egg freezing process. So during the actual time of ovarian stimulation, really what you're looking at is a 2-week window where you need to have a little bit of flexibility in terms of coming in for monitoring whenever you're ready to get started about every 2 to 3 days for a 10 to 14 day period. And so to kind of backtrack and kind of explain how this process works. So if we think about a natural cycle, in your natural cycle, you have a group of eggs that become responsive to hormone that you've had since before you were born. And out of that group of eggs, you get the emergence of one dominant follicle, which every month releases, assuming that you have regular menstrual cycles, and you have that opportunity of pregnancy with utilizing that egg. And the rest of the group of eggs that were became responsive to hormones die off. It's a very inefficient process, hence why only 400 to 500 out of the millions of eggs that we started with you can attempt pregnancy with. Well, in comparison, if we think about an egg freezing process, essentially what you're doing is you're taking that group of eggs that become responsive to hormone, and you're trying to rescue the entire group with the use of injectable medications called gonadotropins, which are essentially the same hormones that your brain naturally secretes to create one dominant follicle. But instead of that one dominant follicle, we actually give you a higher dosage of the medication so that we can try to rescue the entire group. So this is not stealing any eggs of your future. These are eggs that otherwise would have died this month had you not rescued them. So during the ovarian stimulation process, you'll be taking injectable medications to kind of help rescue that entire cohort for about 10 to 14 days. Most of the time, it's closer to the 10 side, where we'd be doing ultrasound monitoring every 2 to 3 days. And then once your follicles are large enough in size and once your estrogen levels are at a good range, then we would trigger you to cause the final maturation of the eggs. And then you would undergo egg retrieval, which you are comfortably asleep for about 15 to 20 minutes. And with a transvaginal ultrasound, so there's no incisions anywhere, we will actually aspirate or drain all the follicular fluid, including the egg. We have an embryologist who's in the operating room with us, who is under a microscope, giving us a live count in terms of the total number of eggs. So by the time you wake up, you'll know the total amount of eggs that we retrieved. And then later on that afternoon, the embryologist will prepare the eggs for the vitrification process, in which they're frozen and forever at the age that you froze them. So if you froze them at 34, they'll be forever 34-year-old eggs, even though you may come back and utilize them at the age of 40. So that's essentially kind of how it works. So this is really looking at about a 2-week period. All right. So that's another question that I commonly get. Well, how good are these eggs? I mean, you buy some eggs from the grocery store and they're only good for about a month or so. But we actually looked at this in the literature, and the data supports that there's no difference in survival, fertilization, embryo quality, and live birth rates in eggs that are frozen and thawed for either immediate use or years later. So that's very reassuring for our patients who are freezing their eggs, hoping to potentially utilize them in the future. So forever, so they're technically frozen forever young. And that's one of the big advantages of the vitrification process, is because essentially it freezes the eggs into a metabolically inactive state. So it stays forever young. So does it matter where your eggs are frozen? Absolutely. So in different clinics, they have different expertise in terms of if they even deal with egg freezing, because egg freezing in comparison to embryo freezing is significantly different. The egg has a lot more water volume, and so it's actually trickier to freeze an egg in comparison to an embryo. So if you go to some fertility clinics, particularly smaller fertility clinics that don't necessarily have the expertise, they might be pushing you to freeze embryos because embryos are easier to freeze, and most fertility clinics have experience with embryos if they do a fair number of IVF cases in comparison to egg freezing. So I can tell you one of the big advantages that we have with, Houston Fertility Institute is we actually have our own egg bank. That means that we take our own egg donors through and freeze their eggs as one of the benefits that we offer our patients who are perhaps don't have the ability of utilizing their own eggs. So we have a lot of expertise when it comes to egg freezing because we use that for our patients all the time. And we actually have a high number of our patients that actually do elective egg freezing as well. So I would say that it definitely does matter, and make sure that if you're interested in freezing your eggs, that you talk to your doctor about their expertise with egg freezing, because that's a very important question. And it's very dependent upon the quality of the lab that they have. Okay, so it does matter. So here's a very key point. Is there an alternative to egg freezing? And I want you to know there absolutely is. So it's very important for you to know whether this is right for you or not. So what are the alternatives? Well, you can consider attempting pregnancy sooner, right? The whole purpose of freezing your eggs is because you want to defer pregnancy. And so, potentially considering changing plans or trying to find a life partner sooner. The other alternative is embryo freezing. So if you are in a committed relationship, or if a stable committed relationship, or if you want to utilize the donor sperm services to fertilize your eggs, embryo freezing may be a good alternative for you. The other option is, let's say, for example, you're not interested in freezing your own eggs, but you would be okay with the utilization of another woman's egg, so a younger woman's eggs, so utilization of donor eggs. These are really great options for patients. And so something to consider, and it's really important for you to kind of consider these alternatives to see if undergoing egg freezing is right for you versus not.